about 5:31, so we will go ahead and get started. We may have some people joining us a little bit late, but that's okay. Hopefully everybody can hear me all right. If you are having issues with hearing me, just let me know. You can enter questions or comments into the chat box at any time. I will be pausing during our presentation to take questions. At that time, when I do pause, you will be able to unmute yourself and ask your question. Or again, you can type it into the chat box at any time and I will address questions at our pauses. Hopefully everybody got the email that I sent out earlier this afternoon that included the slides for this presentation, as well as some additional handouts that I will be referencing throughout the presentation. And I think that's all the housekeeping I had. If for some reason somebody didn't get the email, you're always welcome to email me after the presentation and I'll be sure that you get it. This presentation is being recorded and it will be available to view at your convenience. You will be sent an email sometime in the next 24 hours that will include a link to the presentation. It will also include a link to a survey. We do appreciate you filling out those surveys and providing us with your feedback about these presentations so that we can continue to improve them. And we're always open to suggestion on other topics that you might be interested in hearing about. So I think with that, we will get started. So again, good evening. My name is Roma. I'm with the Area Agency on Aging. And tonight we are going to be talking about Medicare during our part 2 of our 4-part Medicare 101 series. Tonight we are talking about Medicare supplements, also known as Medigap, and Medicare Advantage plans, also known as Medicare Part C sometimes. So let's get started. Again, I am with the Area Agency on Aging of the Pikes Peak region. And the mission of the Area Agency on Aging is to work with partner governments and communities in our 3-county region of El Paso, Park, and Teller to coordinate and develop systems that allow people to stay in the community in their homes for as long as possible. I am also the coordinator of the SHIP program for a 9-county region. SHIP program is the State Health Insurance Assistance Program. This is a federally funded program that's designed to provide unbiased and free information and education on all things Medicare. Again, our agency provides SHIP counseling for a total of 9 counties in Colorado. Every county in every state has access to a SHIP program to get free information and education on Medicare, at the very least by toll-free number within that state. On this slide, I have provided both our local Colorado Springs number as well as the statewide toll-free number. If you call that statewide toll-free number from any area in Colorado, it will automatically route you to the SHIP office closest to where you're calling from. A brief recap of what we discussed last week in part 1 of our series. Last week, we talked about eligibility for original Medicare A and B. We talked about enrolling in Medicare A and B. We talked about benefits and coverage of Medicare's Part A and B and the costs associated with that. Medicare A and B are considered or sometimes referred to as original Medicare. And again, tonight we're going to be talking about the 2 primary options that people have to choose from once they are enrolled in original Medicare from the private or open market for insurance purchases. So we're going to talk about Medicare supplements, again, also known as Medigap plans. And we're going to talk about Medicare Advantage plans, also known sometimes as Medicare Part C. These are the options available to anybody who is enrolled in original Medicare. We are going to start by talking about Medicare supplements. Again, also known as Medicare or Medigap. Medicare supplement and Medigap are 2 terms that are interchangeable. 2 terms that mean exactly the same thing. So what is a Medigap or Medicare supplement? Basically, Medicare supplements are private insurance policies that are purchased or that are sold by private insurance companies, and they are solely and specifically designed to supplement or pick up the balance after original Medicare A and B paid their part first, period. So let me say that again. Medicare supplement policies are private insurance policies that you purchase from a private insurance company, and they are solely and specifically designed to pay any balance left over after Medicare Part A and Part B pay their part first, period. All Medicare supplement policies are required to follow both federal and state laws that are designed to protect you. When you purchase a Medicare supplement policy and you get that policy in hand, it must say Medicare supplement insurance, those 3 words in that order in order to be a legitimate policy. The phrase Medigap comes from the thought process that it covers the gaps in your original Medicare coverage, meaning it picks up whatever balances Medicare did pay after they pay their part first. Medicare supplements are standardized, meaning there are a set number of plan levels to choose from, and those plan levels are set in stone across the country, with a few exceptions in 3 states, Massachusetts, Minnesota, and Wisconsin. They have a couple of additional options to choose from. And the cost for a Medicare supplement varies by a number of factors, but it varies primarily by the plan level, by the company you purchase it from, and very much by the zip code that you live in, among many other factors. Medicare supplements or Medigaps only work if you are enrolled in original Medicare A and B, and you must be enrolled in original A and B to enroll in a Medicare supplement. If you have other Medicare related coverage, such as if you're already enrolled in a Medicare Advantage plan, or if you have other creditable coverage, such as a retirement health benefit that coordinates with Medicare, such as para, or if you're a federal retiree, if you're retired military and you have access to TRICARE. In order to use those benefits, which are designed to coordinate with Medicare and act pretty much like a Medicare supplement, you must be enrolled in Medicare A and B, but you would not need or could not have a Medicare supplement in addition to that. Because Medicare supplements are designed to basically act as a secondary coverage to original Medicare, and original Medicare is your primary coverage. Original Medicare, again, is good with any provider, doctor, hospital, anywhere in the United States of America and or our territories that accepts Medicare. And as long as Medicare pays their part for any medically necessary service that you receive, the supplement pays the balance. So original Medicare and a Medicare supplement are typically considered the most affordable health insurance option, especially for people who tend to travel a lot. Again, Medicare supplements are available to anybody who are enrolled in original A and B of Medicare, but there are specific timeframes that are more advantageous for people to purchase a Medicare supplement than others. And we are going to talk about that in detail. So there are opportunities that Medicare provides people who just become enrolled in Medicare to have what's called guarantee issue into a Medicare supplement. And what that means is it would allow you to purchase any level of supplement coverage from any company you want with no questions asked. Outside of a guarantee issue period, you could be potentially subject to underwriting to purchase a Medicare supplement, meaning the insurance company would look at your health history, and if they did not like what they see, they would not sell you coverage. That could be especially important for people who are on Medicare under age 65, so basically due to disability, because it makes it that much harder to purchase a Medicare supplement if you are not in that guarantee issue period. Also, for people who are under 65 on Medicare, be aware that Medicare supplements, even if you purchase it during a guarantee issue period where you're guaranteed to be able to purchase that coverage will be more expensive because you are under age 65 and on Medicare. However, when you age into Medicare, meaning regardless of how long you've been on Medicare prior to age 65, when you turn 65, you would have an additional opportunity to purchase a Medicare supplement with guarantee issue. So you get like a second chance. And that cost would go down significantly once you reach age 65. Colorado does require that Medicare supplement insurance companies offer that guarantee issue to people under age 65 who just become eligible for Medicare. Not every state does that. But in Colorado specifically, you are allowed and they are required to offer that to people under age 65 who become eligible for Medicare for the first time. So buying a Medigap, there is no annual enrollment period for Medigap. There is a guarantee issue period, and this guarantee issue period is typically applicable only to people who are just enrolling in Medicare for the first time, with some exceptions. Guarantee issue, the guarantee issue period is also sometimes referred to as the Medigap open enrollment period. And basically what this is a 6-month window from the time you have both A and B of Medicare in effect. And that 6-month window, once that 6-month clock starts ticking, it can't be stopped. But during that 6-month period from the time you have both A and B of Medicare in effect, you have guarantee issue, meaning during that 6 months, you can purchase any level of coverage of supplement from any company you choose to purchase it from, and no company can turn you down for any reason from purchasing that coverage. You're guaranteed issue to buy that coverage at your convenience. So potentially you could enroll in a different Medicare supplement plan with a different company every month during that 6-month period, regardless of any pre-existing health concerns. However, once that 6-month period expires, if you try and change your supplement plan or company, or you're trying to enroll in a supplement plan for the first time, you would be subject to underwriting. Again, what that means is the insurance company that you're applying to would be allowed to look at your health history based on the questions you answer on an application. And if they didn't like your answers, they would not sell you coverage. Now, some people may say, well, what about the Affordable Care Act that says nobody can be underwritten or denied for pre-existing health issues? Unfortunately, that rule does not apply to Medicare or to Medicare supplements. So these insurance companies are allowed to underwrite in most circumstances. Now, again, there are some exceptions to the rule, which we're going to talk about next. But, as a general rule of thumb, your best opportunity to buy a Medicare supplement is going to be during that initial 6-month guarantee issue period, especially if you have any sort of pre-existing health issue. So exceptions to that rule, meaning there are potentially opportunities to buy this kind of coverage outside of that 6 months guarantee issue. And those opportunities are typically going to involve some sort of loss of other coverage, meaning if you are actively employed and you stop working, you retire, whatever, and you lose that active employer coverage, that's considered an involuntary loss of coverage, and it would provide you a special opportunity to be guaranteed issue into a supplement, even if you've been enrolled in Medicare for more than 6 months. If you have been retired, you have original Medicare, you've been retired, and you have accessed, say, a retirement health benefit that has been coordinating with Medicare, and for some reason your past employer decides to stop providing that health benefit to their retirees. Again, that would be considered an involuntary loss of coverage, and that would provide you with an opportunity to have guarantee issue into a supplement because you lost your coverage through no fault of your own. That also includes COBRA coverage. So for people who are enrolled in Medicare while they are employed and then they stop working and they choose or opt into COBRA coverage, when that coverage ends after 18 months, again, you would be able to buy a Medicare supplement with guarantee issue at the end of that COBRA coverage. There's another way you can have a special opportunity or a special enrollment period with guarantee issue into a Medicare supplement, and that is based on having enrolled or enrolling in a Medicare Advantage plan. and using what they call the test drive. We're going to talk about that particular option in much more detail when we get to that section. So we're not going to cover it too much here. We will talk about it when we get to the next section. Again, Medicare supplement insurance is designed only to pay any balance that Medicare left over after Medicare paid their part first. What that also means is that Medicare supplements do not cover things that Medicare does not cover. So any benefit that is not covered by Medicare, such as long-term care, dental and vision benefits, hearing aids, outpatient prescription drugs, private duty nursing services, anything that's not a benefit of Medicare is not a benefit of a Medicare supplement. Even if it's a benefit of Medicare, if Medicare for some reason denies a service, so you received a service, the doctor billed Medicare, Medicare denied paying for that service because they didn't think it was medically necessary for whatever reason. If Medicare denies a service, the supplement will also deny paying for that service. So again, Medicare supplements are solely and specifically designed to only pay the balance that Medicare may have left over after they pay their part first. So if it's not covered by Medicare, it's not covered by the supplement. In the email that I sent earlier this afternoon, it did include a couple of handouts specifically pertaining to Medicare supplements. The first handout, you see the cover sheet on the screen, Medicare supplement insurance policies in Colorado. It is dated September of 2021, but this is the most current document available. In Colorado, we are fortunate enough that our division of insurance up in Denver takes the time and energy to put this document together. And basically what this document is going to provide you is a complete list of all the companies licensed to sell Medicare supplement insurance in the state of Colorado. It's going to tell you what plan levels each of these companies sell, and it's going to give you approximate monthly premium for each plan that each company sells. I've also included a handout that outlines the different plan levels that you have to choose from to purchase a Medicare supplement. These are, again, the standardized levels of coverage that you have to choose from for purchasing this kind of coverage. This is going to be probably the most important document to study. Medicare supplement plans are labeled A through N, kind of like the alphabet, but obviously they've skipped some levels along, or some letters along the way. This chart used to be labeled A through J like the alphabet, but in the recent past, they removed some plan choices and replaced them with other choices. And instead of keeping the same alphabet levels, they just decided to go on up the alphabet. So again, supplements are sold by plan levels versus Medicare parts. So try not to get confused when I talk about plans versus Medicare parts. These plan levels are what insurance companies sell to give you coverage after Medicare parts have paid. So to give you an idea of what kind of coverage you're buying, again, these are plan levels. Every company in every state across this country sells the plans as they are outlined here on this chart. These are standardized, meaning everyone is selling you the same plan choices. The plan choices will vary in cost. And again, there are other factors. They will vary by state, they will vary by age, they will vary by male or female. All of those kinds of things are taken into consideration when plans determine their premiums. When you're looking at Medicare supplement coverage, you definitely want to choose what level of coverage you think will be adequate coverage for you, potentially for the rest of your life, to go with Medicare. So we'll go over this chart so that you understand what you're looking at. Basically, when we look at this chart, what we're looking at is what each plan covers after Medicare pays their part first. And each plan is going to list the benefits under each plan letter designation. So if we look at this chart and we see every plan covers what they call basic benefits. So if you are looking at Supplement Plan A to go with your original Medicare, Supplement Plan A only provides basic benefit coverage. And what that means basically is it will pay the 20% after Medicare pays its 80% for Part B or outpatient services. And that's all it will pay under Supplement Plan A. Supplement Plan B covers that basic benefit, pays the 20% after Medicare pays their part first, and it also covers the inpatient hospital deductible each and every time you're admitted to the hospital. Plan D, I'm going to skip over C, we're going to go to Plan D. Plan D covers basic benefits, 20% after Medicare for outpatient services, covers the inpatient hospital deductible every time you're admitted to the hospital, and it covers the skilled nursing facility coinsurance. So if you remember from last week, if you have that 3-day or longer hospital stay and you're discharged to a skilled facility after that hospitalization for rehab or recovery, Medicare pays 100% for the first 20 days of that skilled facility stay. And starting at day 21, Medicare continues to pay everything except for a daily coinsurance, which this year is $194.50. Plan D and higher pays that $194.50 per day, starting at day 100. So if you purchase a Plan D, that's the coverage that you're purchasing. You'll also notice Plan D has at the very bottom, foreign travel emergency benefit. Although I hesitate to actually call it a benefit because it's more likely a reimbursement. The way any foreign travel emergency benefit works with a Medicare supplement is that if you have a foreign travel, if you go out of country and are traveling and you have a medical emergency while you're outside of the country, during that medical emergency, you basically have to pay for those services. When you get back home, you can take that bill or that receipt for the emergency services that you paid for, and you can submit it to your supplement. And honestly, what's going to happen is the supplement's going to send it right back to you and say you need to submit it to Medicare first. So then you turn around, you submit it to Medicare. Medicare is going to not deny paying for that medical emergency because you were outside of the United States of America and or our territories. Once you get that denial from Medicare, you take your receipt, you take the Medicare denial, you send it back to your supplement, and they will reimburse you 80% of the cost of that medical emergency after a $250 deductible. So it is not health coverage in a foreign country, but it is some cost reimbursement if you have a medical emergency while you're in a foreign country. And that's how it works with any of these supplement plans. So Supplement Plan D, again, that's what you're buying is basic benefit coverage. You're buying skilled facility coinsurance coverage, hospital deductible, and some foreign travel emergency reimbursement. Plan G is probably going to provide you the most benefit. It's currently considered basically the Cadillac of Medicare supplements, covers basic benefits, pays the 20% after Part B services, your skilled nursing facility coinsurance, your Part A deductible, provides that foreign travel reimbursement, and it also covers what's called Part B excess. When you have original Medicare's or primary insurance, there are basically two ways doctors can take Medicare as a primary insurance. And what that means is there are two ways that doctors will bill Medicare. So for most people who have original Medicare and have a medical service, the way it works is, say you are going for a basic office visit, standard office visit, and that doctor would charge anybody walking off the street with no insurance $300 for that office visit. But you have Medicare, so when you go in for your office visit, that doctor is going to bill his basically retail price of $300 to Medicare. Medicare is going to turn around and they're going to assign $100 for that service. What you have to remember is Medicare already has a preset, predetermined dollar amount that they are going to approve or assign for any service you ever receive. They've already decided what that service is worth and what they're going to pay for it. So even though the doctor billed Medicare $300 for that visit, that doctor knew Medicare was going to turn around and reduce that amount to $100, what they think that visit is worth. Medicare pays 80% of that assigned amount of $100. So Medicare pays $80. The balance of $20 goes to your supplement. Under basic benefits, your supplement will pay the $20. Both of those, both Medicare and your supplement will send that money directly to the doctor. That doctor accepts Medicare assignment. So he accepts that $100 between Medicare and your supplement as payment in full. In that scenario, you go in for your visit, you show them your insurance card, you should not have to pay anything at the time of service. That doctor accepts Medicare assignment. The other way a doctor can take Medicare and Medicare patients is kind of going to work the same way. You go for a standard office visit. The doctor is going to bill Medicare that $300 retail cost. Medicare is going to turn around and assign $100 and pay 80% of that. However, when a doctor does not take Medicare assignment, what that doctor is typically going to do is they're going to ask you to pay that $100 up front, plus 15%. So when a doctor does not take assignment, they are typically going to ask you to pay the full amount that Medicare would assign it for that service up front. The doctor is still going to bill Medicare. By federal law, they're required to bill Medicare for you. Medicare does not want to see a bill directly from you. But when Medicare gets that doctor's bill, Medicare is going to see that that doctor typically does not take assignment, and Medicare is going to assume that you've already paid that doctor up front. So when Medicare gets that claim from the doctor, they're going to process it. They're going to turn around and pay 80% of $100, and they're going to send you a check directly. They're going to send the balance of $20 to your supplement. The supplement's going to process and send you a check for $20. But again, when a doctor makes you pay up front like that, that doctor is allowed to charge you 15% above and beyond what Medicare assigned for that service. Again, Medicare already has a predetermined dollar amount for any service you can receive. So doctors do know what they're going to get paid for any service they provide, and they can tack on 15% on top of that and ask you to pay that up front. That extra 15% that you end up paying up front is called Part B excess, which is a benefit of Plan G supplement. So if you have Plan G supplement and you have that Part B excess benefit included, not only would your supplement pay the 20% or the $20 in this example and send that to you directly, but they would also reimburse you that extra 15% that you paid on top of the Medicare allowed. So between Medicare and your supplement, you would get all of your money back. If you had a plan that did not include that Part B excess benefit, you would still get the $100 back, but you wouldn't get the extra 15% you paid up front back. Only one plan currently covers that, basically. And honestly, in El Paso County area, providers that make you pay up front are far and few between. However, in other areas of the country or even other areas of the state of Colorado, that may differ. And there may be more doctors in other areas that make you or ask you to pay up front because they do not take assignment. It really is going to depend on who you go to and what their policy is. But again, it's really not that common of a practice. The reason Medicare allows this kind of payment is to incentivize more doctors to participate in the Medicare program by allowing them to make an extra 15% above what they would normally pay doctors. Plan K and L and M and N, the last four plans on this chart, are kind of hybrids of the first four plans on this chart. Whereas the first four plans on this chart are designed to pay 100% of whatever balance Medicare left over, plans K through N are designed to pay a little bit less than that. So for example, plans K and L, for all of the first three benefits, the basic benefit, the skilled facility coinsurance, and the Part A hospital deductible, Plan K pays all of those benefits at 50%. Plan L pays them at 75% of the balance left over. Because those plans don't pay 100% after Medicare, they do have maximum out-of-pocket limits, meaning if you end up spending in your 15% or 25% that you have to pay up to a certain dollar amount. For 2022, it's $6,620 or $3,310. Then that plan would have to pay 100% for the rest of the calendar year after you met that out of pocket. That would be difficult to do in most cases unless you're having a really, really, really bad year. But they do have those limits if it came to that. Plan M does pay 100% for basic benefits, does pay 100% for skilled nursing coinsurance, but it only pays 50% for the hospital deductible. Again, for this year, it's $1,556. Plan N, which is becoming rather popular, covers 100% of the basic benefits, except for a $50 copay if you have an ER visit, or a $20 copay if you have a regular office visit of any sort. Other than that, it pays 100% for all other Part B services after Medicare pays first, pays 100% for skilled nursing coinsurance, pays 100% for Part A deductible. Both of those plans include that foreign travel emergency reimbursement. Again, if this is the kind of coverage you're looking at, what I encourage people to do is pick your plan first, determine what level of coverage you are most comfortable with, potentially having to go with your Medicare for the long haul, maybe the rest of your life. Now, there are two plans that are grayed out on this chart, Plan C and Plan F. The reason these plans are grayed out is because these plans are only available to people who are enrolling in Medicare for the first time, but were eligible to enroll in Medicare prior to 2020. So if you were turning 65 3 years ago, and you were still working, you continue to work for another 2 or 3 years. Now you finally decided to stop working, you're going to retire. Now you're going to enroll in Medicare. Because you were eligible to enroll in Medicare 3 years ago before 2020, you would still have the option of purchasing a Plan C or a Plan F supplement. Anybody who became eligible for Medicare after January 1st of 2020 does not have the option of purchasing a C or an F. The only difference between Plan C and F and the current plan coverage of D and G is that Plan C and F also include coverage for the annual Part B deductible. Again, as we talked about last week, Part B deductible for this year is $223. The reason these plans are no longer available after 2020 or to people who become eligible for Medicare for the first time after 2020 is because they covered that Part B annual deductible. And the government decided that is considered first dollar coverage, meaning potentially between Medicare A and B and a supplement Plan F, you would literally have 100% medical coverage for any medical service that Medicare covered, that was too good of coverage, basically. And it provided 100% first dollar coverage on all your medical expenses outside of your premium. So because that was considered too good of coverage, those plans have been retired for people who turned 65 or became Medicare eligible after 2020. Again, if you were eligible before 2020, these plans are still an option. They might be a little more expensive than the current plans D and G, but they would still be available. Having said that, Plan G versus Plan F. Again, the only difference between those two plans is that Plan F covers the annual $200 deductible, Plan G does not. But many times what you'll find is if you have a company that sells a Plan G and a Plan F, the difference in premium, meaning the Plan G premium would be lower than the Plan F premium, would more than make up typically for that $200 deductible. Just something to think about for people who are eligible for that benefit. Again, I encourage people to pick their plan first, decide what level of coverage you want first, and then start shopping around. We'll go back to that handout that I initially showed you, Medicare supplements in Colorado. In that handout, the first several pages are going to give you some basic information, pretty much what I've covered already today. The second half of that handout is going to have charts, like the one you see on the screen. These charts are going to be grouped by age, meaning at the very top in the center, you're going to see age 65. That's going to be for 2 pages. On the third page, it's going to say age 70. And then 2 pages after that, it's going to say age 75 and so forth. It's going to list every company licensed to sell a supplement in the state of Colorado along the left-hand side in alphabetical order. It's going to have A through N across the top, just like the chart we just looked at. If you intersect a company, and we'll pick Blue Cross Blue Shield here, and you intersect that with a plan letter designation. So you go down, say you pick a plan G, you go down the list, have it intersect with Blue Cross Blue Shield. If there is a number in the box where those two intersect, that number does represent an approximate monthly premium for that plan with that company. Now, having said that, I want you to focus on the word approximate. This handout is not designed to give you exact price quotes. That would be impossible because prices can vary from zip code to zip code a little bit. However, whatever prices you see listed here are going to be in the ballpark for whatever plan you're looking at with whatever company you're looking at. So you'll also notice at the top of this, this is for a non-smoker age 65 in an 80202 zip code, which is a Denver zip code. And I can honestly tell you, Denver zip codes tend to pay a little bit higher premium than El Paso County zip codes. So again, these prices that you see on this chart are not designed to give you exact price quotes. They're designed more or less, excuse me, to basically give you an idea of what your price will look like, a ballpark idea. But more importantly, it's designed to show you what companies charge more and what companies charge less for the same coverage. Again, these plans are standardized, meaning they are set in stone. So a plan G is a plan G is a plan G, no matter who you buy it from. No insurance company can add to these plan levels. They cannot subtract coverage from these plan levels. They're all selling you the exact same coverage, excuse me, based on the plan that you choose. So it very much does pay to shop around. There is no advantage to paying $300 for a plan G from company X when company Y sells it for $150. You're not getting anything more for paying more money. So it does pay to shop around. All right, that was a lot to cover in a short amount of time. Are there any questions about any of that?
I have a question, Ruma. Sorry, I came in late, but you may have already answered it. I don't know. But speaking of what you were just saying, I have the option of also through my husband's retirement at the in another state, but I could also pick one of those supplements. They have one that he has, which is a United Healthcare Medicare Advantage Plan 1. I can't read this form right now as I'm looking. I don't know if it's on there, but either way, would that pay to basically cost the same thing as, like you said?
So when you say Medicare Advantage Plan 1, what they're offering you is a Medicare Advantage plan option. What we're talking about are supplement options, which are a totally different kind of animal.
So are you going to be talking about those? That's what I need to decide on is, do I want a supplement or do I want an Advantage plan? And
we're going to talk about Advantage plan in great detail in just a minute.
Oh, okay. Thank you.
Absolutely.
Roman, this is Lynn. And I have a question. I don't live in El Paso County. I'm in Park. So how do these rates compare in rural counties?
Again, the premiums that you see on this handout are going to be ballpark throughout the state.
Okay. All right.
So
Thank you.
I mean, there might be a few dollar difference. So for example, if we look at the very first listing of United Healthcare, A Plan G shows as $130. You could probably get a Plan G in El Paso County right now for $124 or $120. So the price difference between areas is going to be minimal, you know, $10 or less usually. And that's going to be throughout the state. So it's not going to be like a $50 difference because you live in a different zip code in Colorado. It's going to be usually a $10 or less difference within the state.
Okay, thank you.
You're welcome.
And I guess if you were to relocate to another state, then that they would, whatever figures apply to that state would be automatically.
Potentially, yes. So if you buy a plan in Colorado, whatever you pay in Colorado may change to a different rate based on the state that you move to. It may not. It depends on the company. They have the option of doing that, but they don't always do that. But you are guaranteed to be able to take this with you. This coverage with you goes where you go. So it doesn't matter where you go, it's still the same coverage. And again, some states may change your premium when you get to the new state, especially if that insurance company sells a lot of plans within that state as a norm. Some companies may not change that rate if you move to another state. Just because you bought it in Colorado, you get to keep that Colorado rate. It's really going to be based on the individual companies that you deal with. But again, it shouldn't change significantly just because you make a move either way.
Okay, thank you.
And again, the thing to remember about this kind of insurance, there is no annual enrollment period for this coverage. You get your 6 months of guarantee issue when you first become eligible for Medicare, so that you have guarantee to purchase whatever you want from whomever you want. And once that 6 months expires, outside of, you know, the special enrollment period opportunity, if you try and change that coverage, change your plan within the same company or change to a different company, you are typically going to be subject to underwriting. If you're healthy and you can pass underwriting, you can change plans and companies as often as you want. If you develop or have a pre-existing health issue, that becomes more problematic. And potentially you would be stuck with the coverage that you have for as long as you need it. You wouldn't be able to change because no other company would take you. So once you're in, you're in, and once you're out, you could be out. That's kind of how this coverage works. And this coverage does not include a drug benefit, does not include Part D. So you would have to purchase Part D in addition to a supplement. Having said that, Part D plans in Colorado this year start for as low as $5.50 a month. So plan premiums for a separate Part D are not unreasonable and very much depend on what kind of medication you take. Again, we're going to talk about Part D in much detail next week. Any other questions? All right. Then we will move on. So that was Medicare supplements. Now we're going to talk about Medicare Advantage plans. Medicare Advantage plans, again, are a totally different animal, totally different kind of insurance. So Medicare Advantage plans, basically when you enroll in a Medicare Advantage plan, you are enrolling in a plan through a private insurance company. However, this private insurance company has contracted directly with Medicare. And what that contract means is that Medicare has agreed to pay that private insurance company to act as Medicare for them. So when you enroll in a Medicare Advantage plan, that plan becomes your Medicare, becomes your A and B and sometimes D of Medicare. You still have original Medicare in this situation. It's still always there in the background. You still have to pay the premium for your Medicare. That never stops. But this plan, when you enroll in the Advantage plan, it takes over your Medicare. And all of your Medicare benefits must now go through this private insurance company through that Advantage plan. So sometimes Advantage plans are also referred to as replacement plans. But again, Medicare is always there. It never goes away. It's just in the background now. And again, you still have to pay your premium. In an Advantage plan, you of course still have all your rights and protections. They still have to follow federal and state laws. And they absolutely have to provide any benefit that Medicare provides. But they're called Advantage plans for a reason. And that means that their advantages are that typically they include benefits that are not usually covered by Medicare, such as routine vision, hearing services, dental coverage. They may also offer additional coverage for things that wouldn't even be considered a medical benefit, such as gym memberships. I'm sure everybody over the last holiday in December and November and January, and maybe still today, saw plenty of commercials or heard plenty of commercials or saw plenty of junk mail about Advantage plans touting additional benefits such as the Medicare premium give back, or additional things like transportation. Medicare Advantage plans have now been allowed to offer a huge variety of additional supplemental benefits, typically benefits that are not considered medically necessary or Medicare covered services. We'll talk about a little bit about that as we go. Most Medicare Advantage plans in Colorado do include prescription drug coverage, which would be considered your Part D benefit. So in these plans, when you enroll in an Advantage plan, it becomes your Medicare A, your Medicare B, and your Medicare Part D drug coverage, all rolled up into one package under one insurance. There are some additional eligibility requirements to enroll in an Advantage plan, though, meaning if you purchase an Advantage plan, it must be a plan that's available for purchase in the county that you reside in, your permanent physical address. You, again, must be enrolled in both A and B of Medicare to enroll in an Advantage plan. And there are some additional enrollment periods and opportunities to enroll in Advantage plans, but you're only able to enroll in Advantage plans during these enrollment periods, of course, with some exceptions. So enrolling in a Medicare Advantage plan, obviously you will have an opportunity to enroll in an Advantage plan if you choose to do so when you first become enrolled in Medicare A and B. So that initial enrollment period you have into A and B, that 7-month window, the 3 months prior to, the month of, and 3 months after the month of your 65th birthday or eligibility, you can also enroll in an Advantage plan to be effective at the same time Medicare goes into effect. But there are additional enrollment period opportunities to get into an Advantage plan. So there's the annual election period, which we typically just refer to as the open enrollment period. That's that fall enrollment period. There's the newest enrollment period, which is literally called the Medicare Advantage open enrollment period. And then there are always special enrollment periods that Medicare provides for certain situations. So the annual election period, again, we typically just refer to it as open enrollment. That is the enrollment period that happens every year between October 15th through December 7th. During that time frame, you would be allowed to get into, get out of, or switch from one to another, either Medicare Advantage plan or Medicare Part D standalone drug plan. Any change you make or any enrollment you make during that time frame would automatically go into effect January 1st. So that is the annual enrollment period. Everybody has a chance to get into, get out of, or change their drug plan or Advantage plan. The newest enrollment period, which just started in 2019, applies only to people in a Medicare Advantage plan. So if you are enrolled in a Medicare Advantage plan as of January 1st of any year, you get an additional window of opportunity which is from January 1st to March 31st, to enroll, actually to change from the Advantage plan you're currently enrolled in on January 1st to a different plan, or get out of your Advantage plan altogether and go back to original Medicare with a separate Part D. If you're not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you. It only applies to people who, as of January 1st, are in an Advantage plan. So for example, if you enrolled in an Advantage plan for the first time during the annual enrollment period or open enrollment, that goes into effect January 1st. You have 3 months to change your mind about that Advantage plan. So you would have until March 31st. You can either decide to change to a different Advantage plan or get out of Advantage plans and go back to original Medicare. And then there are the special enrollment periods that Medicare always has an exception to the rule. Again, a special enrollment period provides you an additional opportunity to get into an Advantage plan or a Medicare supplement or a Part D plan based on having lost other coverage involuntarily. So most exceptions to the rule are always going to be framed around that involuntary loss of other credible coverage. The most common way a special enrollment period is provided for people in an Advantage plan is if you are enrolled in an Advantage plan and you decide to move. Again, I mentioned a minute ago that if you enroll in an Advantage plan, you have to enroll in a plan that's available for purchase in the county you reside in. Because you have to buy a plan that's in the county that you reside in, that plan is typically only good in that county. That county is basically going to be your service area or your network area for most purposes. If you move out of that county to a different county, a different state, doesn't matter. If you leave that county as your primary resident, you have to leave your plan behind. It does not go where you go. You have to leave it behind. And because it's not your fault that you have to leave it behind, it's considered involuntary loss of coverage. And Medicare provides you with an opportunity when you get to where you're going, to wherever you're moving to, you get an opportunity to either enroll in a new Advantage plan in that new area, or you get a guarantee issue for a small window of time into a Medicare supplement. So keep that in mind. If you move out of your service area or your county of residence, you can't take your Advantage plan with you. When you get to where you're going, you can either enroll in another Advantage plan available in that area, or you have guarantee issue into a Medicare supplement. The other common way a special enrollment period for Advantage plans is accessed is through what they call the test drive. Medicare Advantage plans have become pretty popular pretty quickly. 15 years ago, Medicare Advantage plans were not quite as prevalent as they are today. There in Colorado, there was probably 2. Today, there are, say, 50 plus plans available to choose from. Because they have become so prevalent so quickly, there is a lot of misunderstanding about how these plans work. There is a lot of misleading marketing that Medicare is always trying to crack down on. There's a lot of marketing in general. So whether it's junk mail, TV commercials, whatever, there's a lot of advertising surrounding these kinds of plans and a lot of claims made. So many times people will enroll in this kind of coverage, not fully understanding how this coverage works, and realize that that wasn't a good choice for them. Because that became so common for a little while, Medicare created a rule that said that for people enrolling in an Advantage plan for the first time, they're going to give you a test drive opportunity, meaning they're going to give you a 12-month period to let you try that kind of coverage out to see if it's actually what you anticipated it to be, or it's going to work for you in general. So if you are just becoming eligible for Medicare at age 65 and you enroll in Medicare at age 65 and you choose to enroll in a Medicare Advantage plan, when you enroll in Medicare at age 65, you get this 12-month test drive. If at any point during that 12-month period, you decide that Advantage plans are not for you, you would have rather have purchased a supplement or maybe nothing at all, you would be allowed to get out of the Advantage plan and still have guarantee issue into a supplement, even if it's past your initial 6 months guarantee issue. So it kind of extends your 6-month window of guarantee issue in this scenario. If you do the Advantage plan when you turn 65 and enroll in Medicare. Very specific, you have to enroll in Medicare when you turn 65 to use the test drive. The other way you can take advantage of a test drive, though, is if you enroll in Medicare at any age when you first get Medicare. You enroll in a Medigap or Medicare supplement when you first get Medicare, and you maintain coverage in that supplement without any breaks in that coverage. And then 1 year down the road, you simply decide you want to try the Advantage plan during an open enrollment period. In that scenario, you would be allowed to drop your supplement, enroll in the Advantage plan, have 12 months to test drive it out. And if you decide within that 12 months that, no, that's not for you, you'd rather have your supplement back, your guaranteed issue back into the supplement you dropped with no questions asked. And that doesn't matter how long down the road after you are with Medicare and a supplement that you take advantage of that opportunity, as long as your supplement coverage is maintained without any breaks in that coverage. Hopefully that makes sense. So you'll notice that much of that I just talked about is always providing not only an opportunity to get a different Advantage plan, but also an opportunity to be guaranteed issue into a supplement. And that's basically because supplements are considered more comprehensive coverage. On the other hand, it's going to be more expensive coverage. So in a Medicare Advantage plan, let's talk about costs. Medicare Advantage plans do tend to have much, much lower or zero premiums versus Medicare supplements. Again, you still have to pay your Part B premium. There's no getting out of that. But to get into an Advantage plan, you may not have any additional premium to pay. Or if you have a premium, it would be much lower versus a supplement. On the other hand, what you have to pay for services is also different. Most Medicare Advantage plans will always require that you pay a copay at the time of service for most services that you receive while you're enrolled in a Medicare Advantage plan. So copays, sometimes co-insurances, meaning you pay a percentage of cost, and more often than not these days, there may also be deductibles applied in a Medicare Advantage plan. But again, Advantage plans must cover all Medicare covered services. Most plans, especially in Colorado, do include Part D at no extra cost. However, you could be limited to what providers you can use or what doctors you can see. And again, that's typically going to be because you're limited to a service area with that plan. The exception to that rule is in a medical emergency. So if you were 2 states away visiting family and you have a medical emergency, your Advantage plan does have to pay for that because it was an emergency no matter where you're at. But if you're 2 states away visiting family and you think you're catching the flu and you want to go see a doctor just to see if it's the flu, that's not going to be considered a medical emergency. And your Advantage plan would not pay for that visit outside of your service area in most cases. So the benefit structure and the cost sharing is significantly different than how Medicare and a Medicare supplement covers the cost of services. And then just to make things a little bit more interesting, there are several different kinds of Advantage plans to choose from. So you have your standard health maintenance organization or HMOs. You have Ppos, preferred provider organizations, fee-for-service plans. There are special needs plans. There are PACE programs. Medicare savings accounts are an option that are available in some parts of the country. Unfortunately, Colorado does not currently offer any Medicare savings account advantage plans. Cost plans we're going to skip over because they've been sunsetted. Colorado doesn't currently have any demonstration or pilot programs available. But again, we do have PACE programs. These are all different types of advantage plans that you may have to choose from. So we're going to talk about each kind of plan and how they differ from one another here real quick. Starting with HMOs. So HMOs, if you've ever been in an HMO or had to use an HMO, you may understand what I'm saying when I say an HMO is an HMO is an HMO. They all work the same way. They can be the most restrictive kind of plan. In an HMO, you are absolutely limited to a network of contracted providers and facilities. You have to use whoever they contract with. You are not able to go out of network. If you use providers or facilities out of network, you pay out of pocket. The plan pays nothing. In most HMOs, you are required to get a referral to see a specialist, oftentimes every time you want to see a specialist. You are limited to what doctors and hospitals you can use based on whoever they contract with, except again, in a medical emergency, no matter what kind of advantage plan you have, if you have a medical emergency outside of your service area, they have to pay for it. And typically HMOs will always include Part D coverage. PPOs are designed to be a little more flexible. So preferred provider organization means that advantage plan has a network of providers and facilities they would prefer you use, that they've contracted with. And if you go to that network of providers and facilities, you will pay lower copays and have less hoops to jump through. However, you're not limited to their contracted provider network. You are allowed to go out of network and see any doctor that is willing to accept you and your PPO plans payment for services. So they have a network they prefer you to use. You pay smaller copays if you use it, but if you are able to find a provider outside of that network that is willing to take your insurance, you would be able to go to any provider you chose. You would pay a higher copay to go out of network. And again, it's up to the provider as to whether or not they want to accept your insurance plan and take you as a patient. They're not required to because they're not contracted providers. PPO plans may or may not come with a Part D benefit. If it does not come with a Part D benefit, there should be a good reason why you don't need it to have a Part D benefit, because you would not be allowed to purchase a Part D separately in order to have drug coverage. Most people who buy a PPO without drug coverage are typically going to have another option for drug benefits, such as the VA or TRICARE or something like that. Fee-for-service plans were designed to be the most flexible advantage plan option, and they were designed to have no network, meaning potentially you could go to any provider in your service area, county of residence, and see any doctor who was willing to take your insurance, and whatever that insurance pays them plus your copay is payment in full. No referrals required. Copays stay the same because there's no network. The downside of these plans is that there is no contract with these providers. So if you find a provider who's willing to take you as a patient and take your insurance as payment, one day you could try and make an appointment with them a month later and they would not have to take you as a patient. They could say, no, they don't want that insurance anymore because there's nothing holding them or contracting them to have to take you as a patient. So, you know, if you can find a provider willing to take you on an ongoing basis, great, but just be aware that there's nothing that says they have to take you ever. So they can decide from day to day what insurance they will take or whether or not they'll take that particular kind of insurance you have. So no referrals required, no network to worry about. You can go anywhere you want to go within your service area, as long as you can find a provider who's willing to take your insurance. The downside is that a lot of insurance agents were selling these kinds of plans in counties that no provider was willing to take them. So that became problematic, and Medicare did have to make a rule that said that these kinds of plans do now have to contract with at least one provider in every county that they're sold in, so that there's at least one provider that people can use if they're enrolled in a plan like that. These plans may or may not come with Part D drug coverage. However, if you buy a fee-for-service advantage plan that does not include Part D, you would be able to purchase a separate Part D in addition to this plan so that you have drug coverage. Special needs plans are basically going to be HMOs, but for very specific populations. And those populations are going to be people who are eligible for both Medicare and Medicaid, or people who live in certain institutions like long-term care facilities, or perhaps may have multiple qualifying chronic health conditions. Again, these are basically HMOs, but for very specific populations. Not every area of Colorado offers special needs plans for those populations, but you can always call Medicare or look at your Medicare New Handbook to see what areas do offer them. If anybody wants any additional information or more specific information on any of these plan types that I'm talking about, you're always welcome to email or give us a call. PACE program is the last option that we're going to talk about. PACE program. PACE stands for Program of All-Inclusive Care for the Elderly. Basically, the PACE program is an advantage plan, an HMO advantage plan on steroids, because it takes that maintenance part of the HMO to the next level. So people who enroll in a PACE program are enrolling in an HMO type advantage plan that provides more comprehensive services for management of healthcare. So it provides case management, it provides, socialization opportunities, it provides potentially some in-home services, transportation services. Basically, this is going to be an HMO for a very specific population of people on Medicare and Medicaid long-term care. And this program is basically designed to help people stay in their homes in the community versus going into a assisted living or a skilled nursing facility for long-term care. All right. Any questions about any of that so far?
I had one question, the part regarding the PPO Advantage plan. Those are good throughout the US, right? In any state you're at, like if you were to be traveling and you have an accident, God forbid, then you end up in a hospital.
Yeah, any emergency has to be covered by any advantage plan, anywhere you're at.
By any advantage plan?
By all of these advantage plans, yes.
Okay. But you mentioned something about the Part D. Yeah, so if you're saying if the advantage plan, most advantage plans do not include Part D, which is the prescription part, but you said something about a lot of them do by other means. I'm not sure I understood that.
So most advantage plans, especially in Colorado, do include Part D already incorporated into their benefits.
Okay.
So most plans include Part D as in drug.
Okay.
If there are a handful of plans that do not automatically include Part D, were to enroll in one of those plans, you may or may not be able to get Part D separately so that you have drug coverage. Again, there's only a handful of plans that do not include Part D, and those plans are typically marketed towards people who have other drug coverage options, such as veterans or retired military.
Okay.
Any other questions?
No, I will be, my Medicaid or Medicare will be effective July the 1st. I got to get my application in for A and B, and then do I have to choose a supplement or an advantage plan at the time I submit my application or my paperwork for the original Medicare?
No, because you're going to apply for Medicare through Social Security, and they don't do anything but enroll you in Medicare.
Okay, so that's it. And then I don't have a certain amount of time where I have to choose the Advantage or Supplement.
So you have, again, that 7-month window, which includes the 3 months prior to turning 65 or enrolling in Medicare, the month of, and then up to 3 months after. So you have at least a 3-month window after your Medicare goes into effect to enroll in an Advantage plan or a Part D plan. And then you have that 6-month window to enroll in a supplement.
Okay, all right.
So, I mean, you could potentially coordinate everything to start at the same time, but you don't have to. You still have a couple of months, 3 months after your Medicare kicks in to enroll in whatever else you want.
Yeah, because I don't want to, at my peer, you can get penalized for not doing things on time. And I was going to do submit my original Medicare A and B now, like this next month. And then, but I'm still waiting for the package from the Advantage plan that I'm going to be considering.
Okay.
After I look at the supplement, I'm a little confused with the differences in both. So I'll look at the information you send and maybe watch this video again.
Absolutely. And don't forget, we have counselors available at our office for individual consultations. So if anybody wants to go over this information one-on-one with a counselor, we are available. Give us a call. We can schedule an appointment. We can do it over the phone, over Zoom. We are starting to take in-person appointments at our office now. So, you know, if anybody wants to talk in more detail about these options or how these options affect your specific situation, we're happy to do that.
Okay, because I was just trying to make an in-office appointment to apply for the Part A and B through Social Security, and they're not taking in office.
Correct. Although we did just find out last Thursday that they have started opening their doors to the public. So they just announced that on Wednesday, that starting last Thursday, they are now open to the public again, although they are still strongly encouraging people to either call or go online to their website.
Yeah, because that's what they told me to do, is just go on the website or call.
Yeah, and honestly, it can be a very seamless and quick process to enroll in Medicare online if you create a My Medicare account.
That's what I'm planning on doing. So
Yeah.
I'll step in any time, and then I can wait for that package to come in so I can study that plan more, and then also educate myself about the supplement, which that's where I'm
Absolutely.
focused. Yeah.
Absolutely. And again, we're available if anybody wants to sit down with us or talk to us one-on-one about your specifics.
Okay, thank you.
Okay. So wrap up Advantage plans. An Advantage plan, if you enroll in Advantage plan, of course, you still have all your rights and protections as if you have original Medicare. You have additional rights and protections in Advantage plan, and those rights include having access to healthcare providers, which is important because if you enroll in Advantage plan and somehow they have not contracted an adequate network of providers for you to use, then there's a problem with that plan. So you should always have access to the healthcare providers that you need. You have the right to know how those doctors get paid. You have always the right to fast, fair, and efficient appeals processes and even faster appeal processes in some healthcare settings. You always have the right to get the services that you need. You have the right to get information about your coverage in easy to understand language. And of course, you should always have the right to have your personal medical information kept private. So I mentioned a little while ago that we are inundated these days with advertising about Advantage plans. Most of the junk mail, most of the TV commercials you might see are regarding Advantage plans. They have become a huge moneymaker for a lot of insurance companies. There are significant advantages to Advantage plans for some people. Advantage plans are not for everybody, just like supplements are not for everybody. Unfortunately, insurance sales are what it is, and insurance salespeople can sometimes be very convincing, and people tend to enroll in plans that are not appropriate to them. Medicare has had to create a lot of rules around the marketing of these kinds of plans. meaning basically there's a lot of things that these insurance companies and insurance agents and brokers are not allowed to do when it comes to marketing plans to you. Some of the things they are not allowed to do is insurance agents or brokers are not allowed to approach you in common areas such as parking lots, sidewalks, lobbies, hallways. They are not allowed to send unsolicited text or make unsolicited calls to you. So if you are getting a call or a text from a company you have never dealt with in your life, they're not supposed to be doing that. What they can do is send you emails or texts or regular standard snail mail, junk mail. As long as the emails and texts have opt-out options so that you can opt out of ever receiving that email or text again. And then of course, there's not much anybody can do to stop regular mail, junk mail. But it's all very generic. It's not calling you directly. They are not allowed to describe their products that they're selling as Advantage plans as free. So if someone's trying to describe a zero premium plan as a free plan, that is not allowed. They're also not allowed to promote reductions in deductibles or your cost sharing, because that's not allowed and that would not happen. If you are interested in attending a presentation by an Advantage plan broker or agent, if you choose to attend that presentation, just keep in mind that they cannot require that you sign a sign-in sheet and provide them with your name or contact information. They cannot require that, and you do not have to give them that information. If you choose to give them that information, be aware that they will contact you and try and sell you something. They are also not allowed to camp out at medical providers' offices. So they are not allowed to have a table set up in the doctor's office lobby. They are not allowed to have a table set up in, a hospital's weight room or anything like that. That's not allowed. Now, if they have a table set up, say in Walmart, they can do that. But they're not allowed to walk from the table over to you. That's not allowed. You're allowed to walk up to the table and ask for information, but they cannot come up to you. They should not be misrepresenting themselves or the products that they're selling as representing Medicare. They're not supposed to conduct marketing events at the same time they're trying to conduct an educational event. So many times agents and brokers will offer a presentation that tells you Medicare 101. That's considered an educational event. If during that event, they also try and talk to you about only the product that they sell or how good the product they sell is for Medicare or as your Medicare benefit, that would not be allowed. However, as long as they are presenting an acceptable educational presentation, meaning they're just giving you the facts of Medicare, once you leave that presentation, they can have a table right outside the door that tries to sell you something. They are not allowed to provide meals at any marketing or sales events. So a lot of times when these plans were first starting to be marketed hot and heavy, you would get cards in the mail that says, come to this King's Buffet and we'll give you a free dinner if you sit and listen to our presentation. That is no longer allowed. They can provide light refreshments and snacks, but no meals. Any free items that they are able to give you do have dollar limits of $15 or less. $75 if you attend multiple presentations or events that provide free items. And gifts in those events have to be provided to anybody who attends and not just specific people. Most importantly, these agents and brokers are not allowed to go door to door. They're not allowed to knock on your door without you inviting them. They're not allowed to leave flyers or brochures on your door or at your door. They're not supposed to be able to get into a secure senior apartment complex and just start going down the hallway, knocking on doors to see who opens the door. That is absolutely not allowed. and absolutely something that Medicare would want to hear about if you see it happening. Any of these cannots are you're strongly encouraged to report that, whether you report that to me as a SHIP counselor, whether you call 1-800-Medicare and report that. You can call the state office for the SHIP program or the Division of Insurance. Any of these cannot activities should be reported, and we do strongly encourage you to report that to somebody, even if it's an anonymous report, because if nobody's reporting it, we don't know that it's happening. There are a lot more of them than there are of us, and you know, any help we can get out there when someone sees something inappropriate is always greatly appreciated. There are some things that these plans are required to do, meaning all of these plans that do marketing are required to submit any materials that they use in marketing, whether it be commercials, junk mail, whatever, have to submit that to Medicare for approval before they can start using it. They are absolutely supposed to comply with any do not call registry that you may be listed on. However, we all know how well that works sometimes. They must obtain permission from you to contact you. If you are contacted because you wanted to be contacted, you end up scheduling an appointment to talk to one of these people in person because you are really interested in what they are selling you. When you have that appointment, they are supposed to present you with a form to sign that is called a scope of appointment. That scope of appointment means that they understand that they're only allowed to talk to you about one product at a time. So if you make an appointment, a sales appointment with an agent to talk about enrolling in the Advantage plans that they are selling, and at the end of that appointment, they start talking to you about, you know, money market accounts or drug coverage or any other kind of insurance product, that is not allowed. What would be allowed is if you say at the end of that appointment, yes, I want to talk to you about other products, let's make another appointment. And then they would be able to have another appointment with you, that they would only be able to talk about that other product. There are a lot of rules surrounding marketing of Medicare Advantage plans, unfortunately, for some very good reasons. I did include in the email that I sent out earlier some additional material that goes over some of these rules and do's and don'ts and stuff like that. Again, if anybody sees any of these activities occurring, please let us know. Even if it's an anonymous, let us know. At least it gives us some place to look and to keep an eye out on. So things to take into consideration if this is an option you're looking at. These are questions I really want people to ask themselves before they actually enroll in something. Because most of these plans include drug coverage, Part D coverage, please make sure that whatever plan you're looking at covers the drugs specifically that you take. Every Advantage plan that includes a Part D benefit, every Part D plan that's a standalone benefit, and we'll talk about this more in detail next week. Every plan offers a different list of drugs that they cover. So there is no one-size-fits-all drug benefit with Medicare. Every option that is available has a different list of drugs that it covers. So please make sure that your specific drugs are covered by the plans that you are specifically looking at. If you currently have doctors and providers that you want to keep, I would encourage you to check with those doctors and providers as to whether or not they take any of the Advantage plans that you're looking at enrolling in. If you enroll in a plan that your current providers do not accept, you would not be able to see those providers anymore without paying out of pocket. If you have a hospital preference, specifically here in El Paso County, we have 2 primary hospital networks. In the past, some people have had very, very strong opinions about one hospital network over the other. If that is the case, make sure you know which hospital network a particular plan has contracted with. And that can change from year to year. If you have some health concerns and you see specialists, or you see multiple specialists. Make sure you know whether or not the plan that you're looking at would require you to get a referral before you see any specialist. If you see multiple specialists throughout the year, remember, some plans may require that referral each and every time you need to see each and every specialist or each and every visit. So that would mean potentially 2 copays to see that specialist, 1 for each provider. And you will pay higher copays to see those specialists versus your primary doctor. And those are just a few questions to ask. A lot of people tend to focus on those extra benefits. They want the dental, they want the vision, they want whatever. Those benefits are all good and well. If those benefits are the benefits that you are most interested in because you know you're relatively healthy, you only want those extras that Medicare doesn't cover, please, please, please make sure you have whatever plan you're interested in looking at explain to you in detail how those benefits are accessible, what providers you have to use or not have to use to access those benefits, because again, these plans must contract with providers, and that typically includes dental or vision providers as well. You can't just assume that if a plan has a dental benefit, you can go to your regular dentist and they will take it, because that's not usually how it works. So you want to make sure you know how to access those benefits, what the limitations of those benefits are, meaning how much coverage do they actually give you for those services, what kind of network of providers those benefits have to offer, all of those kinds of things. Make sure you understand the details of how those benefits are used and how you access them and what they cost you. Because there's a lot of advertising about a lot of different services. The other thing you need to understand is there are a lot of plans in Colorado, but the plan choices that you have vary from county to county. So every county in Colorado and every county in every state has a different set of plans to choose from. And plans that are available in El Paso County may not be the same plans, even if they're from the same company. They may not have the same benefits as the plans available in Denver County. So you need to know specifically what's available in your service area or your county of residence, but you can't assume it's going to be the same in the next county. You may not even have anywhere near as much choice in the next county. Colorado Springs has, I think, 27 plans to choose from in El Paso County. There are some counties in Colorado that have no plans, Advantage plans to choose from. So be aware of that as well. Again, in the email that I sent out earlier today, I included a couple handouts specific to Advantage plans. This first handout basically is going to give you a little more detail and specific information about the different kinds of Advantage plans, what the differences are between the Ppos and the Hmos and all that kind of thing. So it's a very good reference handout. And again, it probably gives you a lot more detail than I gave you tonight. I also included this handout. This handout we have put together. Currently, I only have this handout for El Paso County. When I have more volunteers, I try and do El Paso and Teller County. And if I ever had enough volunteers, I would probably try and do my whole 9-county area. But what we've done here is we've listed all of the Advantage plans available in El Paso County, what types of plans they are, what companies they are from. We've listed if they're HMOs, PPOs, etc. And we've given you some basic information about whether or not the plan has a premium, whether or not it has deductibles, what copays are for common services. We've even included what hospital networks they've contracted with this year. The max out of pocket each plan has. So because with these plans, you do have to pay a copay for most every service. So you pay little or no monthly premium, but in exchange for that, you usually pay a copay for every service. But because of that, they have max out of pockets, meaning if you have enough services and you pay enough copays within a calendar year to meet that max out of pocket amount, then that plan would have to start covering your services for the rest of the year at 100% with new copays. And then that would renew every January. So we've provided this handout as kind of like a at a glance handout of all the plans available in El Paso County and a side-by-side of comparing some of those costs. Any questions about any of that? Okay, so we're almost done. We're going to get it wrapped up here. I mentioned last week real briefly that there are some programs available to help people with some Medicare costs if they have limited or low income. Those are the Medicare savings programs. These are programs specifically and solely designed to help cover some of the costs of Medicare, primarily the Medicare Part B premium. I've listed, and unlike last week where my slide was out of date, this is the current income and asset limits for 2022 for these programs. Again, if anybody wants to talk about these programs in more detail, we're happy to do that one-on-one. We also help with applications for these programs. And that is about all I have for you tonight. Are there any other questions? Again, our office also provides senior Medicare Patrol education and information. That is the fraud component of the Medicare advocacy program that we are part of. Goes back to that marketing do's and don'ts. And if you see anything that's not above board, please let us know. We do work directly with Medicare to report those kinds of activities. And again, here's our contact information. Our Colorado Springs office actually serves a total of 9 counties, and if nothing else by toll-free number, although hopefully we'll be able to go out in person to these counties sometime in this year. We have multiple counselors available to talk to one-on-one. We can do Zoom appointments. We are open to in-person appointments at this time, or you can shoot me an email or we can talk over the phone, whatever's most convenient for you. We're happy to help. We're happy to go over this information again. And I think that's it. I'll call one more time for any questions. Going once, going twice. Again, if you did not get the email with the handouts, please send me an email and I will make sure you get them. You will get another email sometime in the next 24 hours that will provide you with a link to a recording of this presentation, and other recordings of previous presentations are available on our website to view at your convenience, as well as the handouts are available to be downloaded as well. If there are no other questions, I will let you guys get on with your evening. Thank you again so much for joining us tonight. Hopefully I will see you all next week when we talk about Medicare Part D in great detail. And again, please let us know if there's anything else we can help you with in the meantime. All right.